now. Hey, camp followers, I am so excited. We've got the lovely David Dycus back. He is amazing. There is nothing that this guy does not know. So get your questions in, because this is an opportunity not to be missed. He's extremely busy, and I am so pleased that he's given us his time. We are going to start talking about identifying the disease, why it's important, a kind of like a preventative approach rather than a reactive approach. But first of all, for those that have not met the lovely David, please tell us a little bit about yourself.
Hey, thanks for having me back. I think this is the second time that I've been able to join you guys. So I'm a board certified surgeon here in the US. I practice at an orthopedic and sports medicine facility, so focused just in the area of orthopedics. I also have my certification in canine rehab. I got that about 5 years ago, so I'm able to incorporate the rehabilitation aspect into a lot of my approaches to patients with orthopedic issues. During my studies in my surgical residency and working on advanced degrees, a lot of my background is in osteoarthritis. A lot of my research is in osteoarthritis. I do a lot of lecturing on the topic of osteoarthritis as well as other things. And I also have an online platform with another human physiotherapist, David Levine. We run what's called the Veterinary Sports Medicine and Rehab Institute to help provide and bridge the link between both the human and animal side of individuals and best way to approach many of our patients with both orthopedic, operative, non-operative problems to help animals have a great quality of life and make sure that we can kind of share the knowledge base amongst everybody around the world.
Yeah, it's really good. I'm going to put links to all of the stuff that you're up to so people can kind of follow you and stalk you.
Perfect.
You do a wide range of stuff. I've been watching you. You're doing a lot of that 3D printing, trying to work out how to do like clever implants for fracture repairs and stuff like that. I've seen you over in China, lecturing over in China, not recently.
Right.
He's just back from Wuhan.
Yeah. Just got off the plane.
Just got off the plane. No, and so you kind of like are everywhere. You're all the conferences. You're really fun to watch what you're getting up to, and it's great because you're human. You're totally approachable. So let's crack on. Let's go for something that I'm becoming more and more passionate about, because I think if we really are going to tackle this disease as it needs to be tackled, we need to collectively start paying it attention earlier. We need to be getting the public on side as well as getting the profession on side. That's the only way to really prevent suffering, and that's what I'm focused on. I'm so focused on, I just can't stand the idea that they're suffering, silently suffering. So I'm just going to give you a little bit of a case taster of something that happens quite frequently so that the public can understand where I'm coming from. First opinion vet, we often see animals for different reasons. It might be an ear infection, dental disease, an upset tummy. It can be something, and we do our clinical exam and we deal with the case in hand. But we might also pick up on something else, such as a young dog who is resistant to flexing their elbows. And when you do ask them to flex their elbows and they eventually give it a go, okay, you get a little bit of a crackle and pop, you get crepitus, and you can feel that they're not happy with it. And you might feel just a slight little, what we call a joint effusion, little swelling, and you bring it to the owner's attention and say, there's something happening here. We need to take this seriously. Let's do something about it. And you can just see the shutters come down. They just don't want to know. And that's really frustrating for vets, and it's frustrating for the dog, because that's when we can do some amazing stuff, isn't it, David? What's your thoughts on that? Do you see that quite a lot, or not so much that you're not first opinion now?
Well, being more of a tertiary referral, I very rarely get those dogs in that they're young and they're coming in for some other comorbidity and we find an orthopedic issue. But you hit the nail square on the head in that as a profession, we spend so much time retroactively managing OA. We're constantly playing catch up. And we need to try to make a paradigm shift so that we can proactively manage OA. And the young dog that comes in for whether it's vaccines, whether it's vomiting, whether it's an annual exam, we can start looking for changes in these dogs. And it doesn't necessarily mean that the dog has to have clinically relevant OA. It could be that this dog is a potential animal that could develop OA. Maybe they've got other underlying issues. And then that opens up the avenue for us to have a discussion with the owner on ways to try to create the environment to slow down and minimize. I get the ability to have a appointment consult that lasts 90 minutes. So I have all the time in the world to explain things to owners, and I love talking to owners. And so I think many times they probably leave my consults and they're like, I just learned more about things than I ever wanted to know. And he covered so much stuff. It gets overwhelming. I think those in general practice have such a difficult time because sometimes you've only got 15, 30 minutes in an appointment. If you're really lucky, 45 minutes. And during that period, you've got to talk about flea and tick preventatives. You've got to talk about the dental stuff, the skin stuff, weight control, a whole number of other things. And then it gets really hard when you try to add on an orthopedic issue.
Yeah.
But there's been development of what's called a post approach, which basically means it stands for Canine Osteoarthritis Staging Tool.
Yeah.
And I know that you're going to have Duncan a little bit later this week.
Brilliant
guy.
Are you so impressed with that or what?
I know. He's a hard guy to get in touch with, So
know.
congrats to you. Tell him hi for me. We had dinner about a month ago in Las Vegas. So
I will. I'll say hi.
He helped develop this coast tool. And what it's designed to do is from both the owner and the veterinarian, to help grade and stage where an animal may be. And the great thing about this is that there is a stage where a dog could be clinically normal, but at risk. The puppy with hip dysplasia, the dog you just said, there's a little bit of resistance to elbow flexion, maybe a little bit of crepitus, not terribly painful, but the owners haven't seen a thing at all going on.
No.
The perfect opportunity to start talking to owners about how do we create some of the environmental aspects to try to slow down and minimize progression of arthritic changes. That's where we can start talking about maintenance of a lean body weight. And what is that? Daily exercise, but maintaining and minimizing concussive forces on the elbows. What activities are okay, but what activities maybe we should avoid so that we don't create promotion of inflammation and worsening cartilage damage. And when we have those patients that maybe we identified it, but maybe they're starting to get a little bit worse or they're starting to have issues, well, we can redo the coast form and say, oh yeah, your grade has actually gotten worse. Maybe there's something that we need to intervene, whether it's an analgesic, whether it's an intra-articular injection, whether it's activity modification or something to try to maintain the life of the joint for as long as possible. That's our goal is, these patients where they've got arthritic changes, we're not going to cure it. We're not going to make it go away. But, what do we do to create the best environment possible for them to have the most comfortable quality of life as possible? And in my mind, try to keep them out of the pharmaceuticals or off the pharmaceuticals for as long as possible and only use it when we need to, not just stick them on a pharmaceutical and say, well, that's all we can do, because we're really not doing anything if that's our approach. So we need to take a very proactive approach to try to identify these dogs. And I think if we can do that, we can create good quality of life for them and also educate the owners along the way, the steps along the way as to what we need to do, because they got to start from the very beginning before things started to become clinically relevant.
I think owners really need a visualization of what if we ignore it. And sometimes when we do like our owner workshops, you can see people going, well, that's not relevant. That, that doesn't really affect my dog. Look, he's still got great quality. You almost want to create this little video clip of a crystal ball and the dog walking through the crystal ball and coming out the other side and go, look, this is our opportunity to intervene. If you don't, this is what's going to happen. And if there's any company out there that wants to help us create that, then just high five me. Because it's needed, and we need it in waiting rooms, we need it in vet clinics, we need it on Facebook pages, that people can actually see the repercussions of not catching it early. And I was chatting to someone recently, and I think that is one of the real problems we've got at the moment is owners understanding the importance. There's that dissonance, isn't there, where they're kind of like, oh well, it's not a problem at the moment, and then suddenly, you know, well not suddenly, a few years later, it's like a major problem, and options are less available, and interventions are more expensive, and potentially less likely to work. It's so difficult. Tell us a little bit more about this Coast tool, because, you know, I love it. I do wonder how easy it is to use in a 15-30 minute consult, though.
Well, the nice thing is that it's designed to be relatively quick once your staff is used to it, because what would happen is you would have your technician getting a history, asking questions. The owner would fill out a client metrology index, whether like a load form or a CBPI or the Helsinki. And that way, while they're waiting on you to come into the exam room, or while you're out reviewing the history, they're filling that out. And then you do your routine exam, just like you normally would. But you also start to pay attention to the joint motion. How do the joints feel? Does it feel like there's a loss of range of motion? Is there thickening? Is there crepitus? Is there pain? If you're really gun-hole and you love orthopedics, you could use goniometry and start measuring joint angles. I think once you learn that, it's very quick and easy. And then if you have a reasoning based on the owner perceived CMI or your examination, it could certainly open up the opportunity to take radiographs if there's time for that. If there's not time for that, what it does is once we have the staging and we can put a grade on there, we can tell the owners, okay, I understand we're here for vomiting and diarrhea. I don't want to overwhelm you today. Let's get this under control. But I just want you to be aware that, we picked up on some issues, that there could be something going on with maybe the elbow or the hip, not causing a major issue right now. But I think if we get onto it early, it may not become a major issue. But I think we need to investigate it a little further. And I think, we might be starting to see some signs of arthritic changes. And you don't have to overwhelm them at that point. I think where education comes into play, certainly websites like yours, as well as others, that lay it out for owners. What the heck is OA? Yeah. What is the multimodal management? And that way you say, what, let's come back in 2 weeks or 4 weeks, and then let's just schedule an appointment so we can chat about this, so that way we can make sure that you understand when we talk about weight management, how do we do that? When we talk about incorporating daily exercise like walking, what do we do that? Why are you telling me to avoid, playing ball on the slick floor, or jumping off of objects? Well, how do we make sense of that? And the Coast tool allows us to get some objective information we can then put in the medical record. And we can start documenting it, and it gives us the ability to follow up on these dogs.
I think that's something that it's only now that I'm obsessed with OA do I realize how odd it is as a vet. There's some things that we document without thinking about it. Every time we do a clinical exam, we're doing heart rate. We are really doing body condition score and weight checks. We do dental checks. Just think about a clinical exam. We're always reviewing certain key points. Quite strange is we do practice preventative medicine a lot. We worm, we flea treat, we vaccinate, and this is a form of preventative medicine, but it just doesn't seem to kind of sink in. And I think there's a couple of reasons. As I say, I think a lot of owners don't want to hear. I can remember when I broke it to a lady gently that her 16-week-old puppy had quite lax hips, and it was a concern to me, and we needed to keep an eye on it. Yeah, that was a very difficult time.
Yeah. I've actually got a dog coming in tomorrow, 16 weeks tomorrow. It's already had a pin hip done, looking for hip laxity, and it's high. So there was a veterinarian out there that was astute enough to say these hips feel a little lax, and they found that because they were at a routine exam doing vaccine, and they had the aspect of let's palpate the joints. It's just part of the routine examination.
I did it, and it was terrifying. It was terrifying. It was almost like, Oh, I didn't sign up for this. But so there's that the owners unfortunately don't want to hear it, and it's a very difficult conversation to have. But also, and this is where we're going to go into, I don't think a lot of vets really know what to do with it at that point. I know when I was at university, I was very taught a reactive way. Once that was there, it was in place, this is what we can do. Once it's painful, once it's remodeling the bone, once that joint capsule's really thickened, this is what we can do now. And I actually have had to kind of go and teach myself the little that I know, I'm learning. I've had to teach myself what to do for earlier onset. And I don't think that's really available. So I just went through the Gallifrant website, who are Elanco, who did fund the coast development. And they're starting to drip feed the idea that there's things that you can do if you catch it early, but it wasn't complete. What sort of stuff is available for people that are going, oh, okay, I'm brave enough to get the examination done of my young dog, but I'm a bit scared of what the outcome will be. Let's talk through what possibilities there are so they don't need to be scared. So let's start from mild. And
okay.
what kind of things? So if you've got a dog that's really, really subclinical, but you've just noticed there's a little bit of crepitus in those elbows, a little bit of restriction, the dog's 1 year old, where would you be going with that?
So I'm going to look at what is not only their body weight, but what's their body condition. I don't know about you guys, but here in the U.S., people and animals are overweight. And we're going to talk about, number one, how do we get weight off of them?
Yeah.
And in the 1 year old dog, if they're overweight, we're going to accomplish that in two ways. The first way is going to be calorie reduction.
Yeah.
And so we'll sometimes work up a worksheet that says, for your dog to get to where we want them, this is how many kilocalories we need to be consuming. And we can look at the dog food they're feeding. We can calculate exactly how much they need to give. The other thing, though, is if you look at people, for example, there's all these fad diets out there, and they might work initially, but they don't keep weight off forever. And it's because you've got to be able to combine diet with daily activity. And owners love to hear that, but I also say, well, let's take a step back. We have to think, though, there are certain activities that can make your dog worse, and there are certain activities that can work in our favor. And the best way to not only get weight off but keep weight off is through walking. Walking is the best form of daily exercise in the dog. And it's not the dog is pulling you down the street. It's not a sniff tour of the city. It's the owner and the dog are both focused on walking at just a regular routine walking pace. For small breed dogs, we might actually have to slow our pace down a little bit so they're not actually running.
That's a really good point. Most people that you see walking their dog, the dog's trotty. The owner's on their phone or daydreaming, and the dog's going. So for the dog, walking.
Yep. The small breed dogs are tough because you got to slow down. You got to pay attention to what you're doing. And the other thing, I don't know about here, people love retractable leashes. I hate retractable leashes because the dog goes running forward and then it catches, it pulls them back, and then the owner catches up, and it's just back and forth. And that is not good motion on not only the cervical region, but the joints as well.
And
so
behaviorally, it screws their head up.
Yeah. So I said, let's get a 4-foot, 6-foot leash. And sometimes you actually have to educate the owners how to teach their dogs to walk on the leash appropriately. And we try to work on getting down to an appropriate body condition. What I find is very challenging, especially if the dog is already overweight, is the owners now feel like, here's this mountain we've got to climb to get weight off. He just said, we've got to get X amount of pounds off. Oh my gosh, this seems daunting. Let's break it down into little bits. In other words, if I have an overweight dog, I want to shoot for about 10% of their body weight initially. And I pulled that number out of thin air because people, if you've got knee OA, they found if you lose 10% of body weight, you can have some comfort on your knee. So I pulled 10% because it's easy for the owners to think, if we started at 10% increment, And we try to do this over about 8 to 10 weeks, so maybe about 1 to 2% per week. That gives us goals to reach. Yeah. And then once we get to that goal, we can reevaluate and say, okay, we hit our 10% goal. Let's get another 10% because your dog was really overweight. Or we can say, you know what, body condition wise, your dog looks beautiful here. Let's keep doing what we're doing in terms of the amount of food you're feeding, as well as how we're doing our daily exercise.
I think that's really important. I think owners need targets. So I always say that we're going to try and lose 1% per week. That's what we're trying for.
Perfect.
And it gives them something to aim for. And I calculate it for them. So, you know, if it's 30 kilo dog, we're going for 300 grams weight loss per week. Come on, we can do this. And then I give them 2 or 3 weeks to hit targets. And if they're not hitting the targets, then we readdress rather than waiting 4 or 5 months going, oh, we haven't done it. And all that time's wasted. So I think absolutely, I totally agree with you. And on the vet and vet nurse aspect, we've got to be more detailed, and we've got to be more thorough, and we've got to kind of give them aids to take away with them, get them motivated. We need to check in with them. We need to make it a competition. We need to do things to keep the incentive there. And then for owners, you've got to understand. I'm going to tell you how bad weight is, owners, how bad. We had a really ill dog come in today, pale as a ghost, absolutely pale as a ghost. And because it was so overweight, I couldn't find jugulars. Okay, so I'm needing a blood sample. We need to know why this dog is ill. And I am feeding around this tree trunk neck going, dudes, I can't find jugulars here. And because it was so collapsed, there was no peripheral veins popping up either. So, wait. Please listen. Let's go from nutrition on the weight control. Where do supplements fit in this? You know, if we got really early in our decision, do they have a role?
What's that? You broke up just a little bit.
Supplements, early.
Okay, so let's talk about that. In the U.S., one of the things that we have that's been FDA approved is Adequan, which is a polysulfated glycosaminoglycan, Adequan Canine. I don't know what you guys have. If that, okay, so you know, Adequan is a really interesting drug because the initial studies, especially when there was this aspect, oh, it can help in dogs with hip dysplasia. It was given to dogs. It's injected into the muscle. It was done twice a week for 4 weeks, so 8 injections. They found that the data supports usage when it started at the absolute earliest moment in the disease condition. Right. For some reason, I have no idea why, we have shifted to saying, well, let's start Adequan later in life when they've already got progressive OA. Let's load them on it and give it to them for a month, and then let's just give it to them monthly thereafter. If that's where we're going to start using it, then we've passed the boat. We've passed what it was designed to do. As far as our other supplements go, so our glucosamine and chondroitin sulfates, our omega-3 fatty acids, I think they play a role, but again, we have to be very careful what we're asking it to do. If I've got a young dog, not clinically lame, we picked up on a little bit of change, there's likely maybe some degree of elbow dysplasia or hip dysplasia or a patella luxation, I have no problem recommending a glucosamine chondroitin sulfate supplement. But at least here in the US and possibly over there as well, you have to be careful because it can be a buyer beware market. Since they're not really federally regulated, there could be anything in that supplement. You know, at least in the US, they're under no legal obligation to meet claims. Yeah. So I think if we're going to recommend a supplement, we need to, at least on the professional side of things, recommend something that's been tested, that even though we can still discuss on how much of a benefit there is, at least what they're getting, we know that what they're getting and the purity is there, so that we don't have to have negative sequelae associated with it.
I'm going to just ask you something a little bit off tangent, just so it's totally real. What would you do if you found a photo of you on a unregulated supplement with extremely non-approved label claims of easing joint pain and almost, you know, just if it was your face, what would you do? It's just happened to me today.
Did you find my face on
No,
on one
my
that was
face.
unregulated?
My
Oh,
face.
cool. Okay.
I tell you, I would tell you. I would be like, David. I've just,
I would not be happy. I would be contacting them and saying,
Mm.
hey, you need to take my face down. Sometimes they'll say, okay. If they say, nope, we're going to use your face because we think you're pretty, okay, then I'm either going to use my social platform to say, I don't support this. Or, as bad as it sounds, take the legal action for somebody, that can write an intimidating letter legally to say, take my picture down.
Be careful, guys. I don't know very many vets that put their name to supplements. Anybody that's really, really into OA and they really care, don't do that. So if you're seeing a picture of somebody that puts their heart and soul into arthritis management and they're run a mile and phone me and let me know, because it's not cool at all. But okay, so back to the supplements. We do have the role of adequine and carchofen. Just as a little sideline, carchofen, a lot of people are using it monthly, and I've always been told it's once every 4 weeks. You use it as a block treatment, and that's how it works, rather than drip feeding it monthly. Same?
Yep. And the problem is I don't know. There was probably some individual years ago that thought, well, if we load it or we give it to them for a month as described, and then let's just give it to them a month after to feel like we're doing something. The problem is there's no data that says taking that approach is beneficial. Now, maybe somebody will come up with a study to showing that there's a beneficial effect by doing that. Right now, at least in the United States, that's considered off-label.
Yeah.
So you have to let owners know that we're using it in a way at which it wasn't approved for. Mm-hmm. And I find that many times, and what really kind of irks me is that a dog will go into the vet and it's a mature dog. They're having mobility issues. So they're going to the vet for mobility issues. So they're likely in an arthritic flare-up. They're diagnosed with OA, and this is the first time they're hearing about it. And so the vet's recommendation is to start Anaquan. That is not the appropriate way to use it. And then the owners come in and say, well, yeah, we tried, it didn't work. Well, I can guarantee you it didn't work because it wasn't used the way that it's designed to be used. Your dog is beyond the point of that being helpful. We probably should have taken another avenue. So I'm more of a fan of trying to use it as early as possible in the course of the disease.
What about things like ASU, so avocado and soybean unsaturated?
So a lot of those
are collagen.
Yep, the avocado, soybean, unspecifiable. Some of the others, the eggshell membrane.
Yes.
Some of these others, green lip mussel. Some of these are really all designed around modulating inflammation. They're not really designed to protect cartilage per se, but they are designed to lower inflammatory mediators. And I'll tell you, in a petri dish, they do an amazing job lowering inflammatory mediators. I mean, I can say that because part of my master's work was working in a lab with canine chondrocytes and seeing how they respond. So I can tell you they respond beautifully. And so what we have to then realize is, well, once we take something orally and it gets through the GI tract, it gets to the joint, how effective is it in what we call in vivo, in the dog? So in those patients with very mild changes, I think I would rather do that and just put them on an anti-inflammatory and do nothing more. Because it may very well be that some of these can maybe modulate that smoldering inflammation a little bit that allows us to create the environmental aspects of weight control and daily exercise without having to start the anti-inflammatory. Many a times we jump straight to the anti-inflammatory and then we leave them on it for years at a time. We don't ever really try to take them off of it. So that aspect, I think, can be helpful. The same can be said with omega-3 fatty acids. Again, it's all about modulating inflammation and trying to lower the inflammatory response and thus basically lower the degree of what's called synovitis, which is the inner lining of the joint that gets really, really, really inflamed. In dogs, we don't know why this is, but dogs, a very, very small insult to the joint causes a really massive synovitis. And that's really where most of the pain's coming from, is going to be that severe inflammatory response of the synovium. And so ways to modulate inflammation from a more homeopathic, natural aspect, I'm all for, but recognizing that they have their place and they also have their limit. And if we try to utilize them past their limit, we're not going to be successful. We got to move on to things from a pharmaceutical standpoint to get inflammation under control, and hopefully get them out of the flare.
Yeah, I think Professor Matthew Allen, who was on last week, was really talking about how we, in the next 10, 20 years, will be able to tailor our treatment to the phenotype more, which I think is fascinating, because we do still just have this blanket approach that every dog with OA is going to get treated with this blanket approach, and how we can understand more about what each dog needs, what their genetics, what their lifestyle requires. I think it's great that you're saying, if you're going to use the supplements, do it early and throw your heart and soul into it and give them 3 months to take effect. But they don't come with a promise. So have your objectives in place. That's where this COAST tool comes into play, because you start using objective monitoring. I think owners that are new to CAM need to understand that we kind of look at these penguin drawings, old children book drawings about what arthritis looks at. And I think that's what we've got in our head as owners. We see this joint and it's all gone a bit gnarly. So all we can think of is it being a mechanical disease. You guys have got to remember, it takes a long time for it to become that mechanically, dysfunctional joint. Before that is a boiling pot of inflammation. There's just loads of, it's a caustic soup in there. And that's where supplements are going to do their job, not remodeling bone, not regrowing cartilage. It's the soup that those supplements are working on. So let's attack the soup before we get all the change, because they're not as effective then. Let's talk about lifestyle, because this is hard. This is really, because most people that have a young dog have a dog because they want the life with it. So I'm going to use me as an example. Luna's one of her dog's cheeks smaller. She's got her right glute smaller, and she's just offloading it a little bit. And I've had her hips scored, and they're absolutely lovely on the Kennel Club hip scoring. I think they're about 5, so they're not bad at all. She's got a faint little Morgan sign. Anyway, she has got a good range of motion in both hips, but she has got a slightly small right bum cheek. And I put her on the stance analyzer last week, and she's just offloaded. She's about 17, 18 in the back, and she's throwing her weight forward a little bit. So I'm thinking, okay, I could do something about this. So I've got the balance cushions out. We're doing slow walking uphill, slow walking downhill. We're learning to walk slowly. If we do any steps up woodlands, she walks slowly. I want her to be putting weight into those back legs. We do kind of give paw, weight shifting. We do side stepping. She's walking upstairs backwards. So all of these things that I think, actually, I can carry on with this for the rest of my life. This can be part of what we do. The thing that I hope people can understand is that it's not no, you can't do anything. It's about looking at what you're doing and go, well, how can we still have such a cool time together, but how can we modify it? Is that the sort of stuff that you suggest?
Oh, 100%. It's the problem is and I would say that you've really led the way on this, because there is virtually nothing known about daily activity modification in dogs with OA. There's so much information known about people that this whole concept of chasing and running and playing can be done with modifications to preserve joint function. Owners love playing ball. Why? Well, they can sit there and talk to their friends. They can throw the ball, and their dog loves it because they're chasing something and they bring it back, and the owner didn't really have to put much of an effort into it. They take the ball, they throw it, and the dog's going out and running after it again. So I think a lot of those, it's dogs perceive to like them, and then owners find them easy because it doesn't involve a lot of interaction on their part. So making some of those modifications and still keeping life fun, you can absolutely do. I have owners that love to go hiking with their dog, and their dog's got arthritic changes. That's perfectly fine. You can still go hiking, but maybe we think about on a Saturday, instead of tackling that really aggressive hard hike for 6 miles, okay, that's great if you want to do that, but maybe why don't you take the less aggressive hike for 3 miles?
Yeah.
And then I also coach them on things they need to be looking for, watching out for in their dogs to know if they're pushing it a little too hard. But I tell them it's all in moderation. We can still do some of these things while we're trying to avoid excessive pressures onto the joints. And so, in the really young dog, owners may say, well, I got this dog as my running buddy. Okay, that's fine. You may be able to tackle a mile or two, and this dog may be able to do that fine. But if you're planning to train for a marathon and you're planning on an 18, 20-mile run with your dog, this particular dog may not be the best marathon runner. So maybe you go out and get warmed up with him, and then you put him in the house and finish your run. You don't have to push through it just because that's what you got the dog for.
And then there could be lots of modifications. We've definitely found, and we know this because we've been now, that if we keep saying no to owners, they do it anyway. But if we say, have you thought about doing, let's put a change in place. And even silly things like we're phone triaging over here with COVID crisis, so we're what we're allowed to see. I think it's the same with you. And a lot of the phone calls that I'm making to owners with dogs with established OA arthritis who are seeing a downturn during this period, a lot of it is lifestyle having a massive influence, and a lot of lifestyle advice is paying off. So only the other day I was talking to an owner, as we dug a bit deeper, the dog pulls on the lead all the time, pulls. So during that point, that dog's so aroused, not feeling discomfort, really pulling through these painful shoulders, but it's got to get there. And I'm like, right, we've got to focus. So use this time during the COVID crisis for us to get on top of this lifestyle, this activity the dog's doing that's aggravating. And they're like, oh yeah, this kind of makes sense, doesn't it? And it is.
Yeah, I think that's, owners are now at home more with their dogs than they've ever been. and so it gives us the opportunity to make the best out of a crappy situation. They can still take their dog out on a walk. You can still practice at least what we call here social distancing, where you're supposed to stay 6 feet away from other people.
Are you still allowed to, or is that going to be taken away from you soon?
Well, if people don't start listening to the rules, then yes, they're going to take that away. It's kind of like saying, you know what, guys, they're treating us like children, saying, we're getting disappointed. If you guys keep it up, we're just going to turn the car around and go home. And so, but they can still go out and take their dogs for a walk, and really work on walking and develop. I think you develop this really nice human animal bond. What kills me is that a lot of times dogs get diagnosed with osteoarthritis, and then the vet says, eliminate all activity. Don't take them for walks. Don't let them do this. Don't let them do that. And the owners are like, okay, here's the death sentence. My dog lives to do this. And I say, that's fine. We don't have to lock your dog in a crate and do nothing. Let's find a way to have fun doing these things and to do it in a way that it promotes joint health and not going to cause joint damage. So we're going to modify what you and your dog like to do, so that way everybody walks away happy. And it's so counterintuitive to tell someone don't be active with your dog if they've got OA, because the whole goal is to maintain range of motion. Because once you lose range of motion, once you lose range of motion, you've lost function. There's a direct correlation of range of motion to function. If you can maintain range of motion or even gain some, you're going to improve function. And the best way to do that is to be moving. But you got to be comfortable. They've got to be comfortable. If they're secretly hurting, we've got to, as veterinarians, figure that out, get that pain under control as quickly as possible to get to an active lifestyle to maintain the range of motion.
And that's where we're going to go next. We're going to go into the dogs that are now actually painful. So we've dealt with dogs that are really quite subclinical, and they just need modifications and maybe a disease modifying osteoarthritic Crohn's, the cartilage veins, and maybe the supplements come in there. But now dogs that are sore and what we can do in that area. You said something that I just wish practices could see the importance. It's only now that I work in a practice that does have stance and gait, they're game changers. They're game changers. Because what happens is the owner can visualize it. If they can't see that their dog is offloading, if they can't see that strange gait, then I put them onto a stance analyzer and it really says, look, they're really offloading. You can see it. Like I've taken this reading now 5 times on this platform 5 times, every time offloading. Or on the gait, you know, you can see them walking and you can see they've got adapted posture. It can be really, really helpful. I was chatting to a lady in the car park, social distancing, the other day, and I said, your dog's got a really abnormal gait. You know, your dog's flicking in with the hocks, flicking out with the stifles. There's instability more proximal in the limb here. And she went, I just thought he walked like that. And I was like, no. And I wanted to get him on the gait, and then she could see that he was actually offloading as an adaptive gait because something wasn't right. So practices, they are available. They're called stance analyzers. The one that we tend to suggest is Companion. And we also have Gait for Dogs, gait analysis, but there's a few out there now. So tell me what you're doing, because you're in there like swim bear. What sort of thing would you be doing for an early but painful?
Yeah, so I think collecting as much objective information as we can. So stance analyzer, gait analysis, measuring muscle circumference, measuring joint angles. So that gives us information to say, here's where we are. Now, here's where we need to get to. And if they're coming in and they're painful, my first thing is, well, how do we get the pain under control? Because if I tell the owner, well, you got to start working on weight loss and daily exercise. Okay, that's great, but my dog can walk 10 minutes and then he hurts, or he can't even walk 10 minutes because he hurts. Okay, so we're going to back off exercise then. That's the point where we can back off if they're painful. And then I'm going to say, well, how do I get this under control? Maybe it's an anti-inflammatory, but my goal there is to say 10 to 14 days, I need to have this pain under control. Maybe it's a joint injection, something like platelet-rich plasma to decrease the inflammation. Maybe it's a combination of different pain medications to get that under control. Once we've got pain under control, I'm going to reevaluate them just to make sure that, yes, they are under control. And then we're going to start a initiation of daily exercise, knowing that, you know what, we're not going to be able to go out on an hour-long walk the day after coming out of resting a little bit. We're going to have to work our way up to it. And we're going to start out, you know, kind of level, flat ground, things that are pretty easy. And then we're just going to add on a little bit, add on a little bit, add on a little bit. But the other thing is trying to make these dogs comfortable, because a lot of these dogs, if they come in and they're hurting and they're coming to see you because they're hurting, they've been in pain for a while. And, you know, if you kind of crouch over and walk around like that for months at a time, and then you try to lift up, your lower abdominal muscles are going to hurt because they've not been used appropriately. These dogs have all sorts of muscle tension. So, you know, getting hands on them, teaching the owners how to work on massage and do some light stretching and range of motion, I think is excellent, especially during that period where they're sort of not being terribly active or doing a lot. We can start slowly stretching them out. Owners can start to feel, oh, that's where the tension's starting to occur. Let's hold that there for a minute. And then let's just slowly make that a normal way of life to where they're kind of massaging and stretching their dog daily when they get back from exercising and that sort of thing. So a lot of them, when we diagnose it and we try to get pain under control, they've never had the discussion of creating lifestyle changes to minimize arthritic changes. So what we're trying to do is get them comfortable so that we can start that process, because now we're behind the curve.
So you were talking about something that a lot of practices don't do. And I'm very rare that I meet practices that are happy to target their treatment. And I hope it is coming, because other diseases are targeted. You know, OA, we just treat the whole dog, don't we? You know, drugs in.
Yes, yes.
What are you using? What are you using in intra-articular? Let's go back to a 1-year-old Labrador with bilateral elbow dysplasia. The hips are okay, but those elbows are a little bit crepitus, a bit crunchy. What sort of stuff are you guys using?
So I think to back up on what you were saying, you know, what I've preach on is that we can't take a cookbook approach, but we have to take a patient-specific patient approach, meaning you've got to look at this dog. What is wrong with this particular dog? How do we create a plan for this dog? As far as intra-articular injections go, I think there's a number of different things, and the problem is that, you know, the research supports some things, is indifferent on others, and it kind of goes back and forth. But I think if I've got the 1-year-old dog, there's tons of cartilage in there. It's really nice and pretty, but there's really bad synovitis. I'm probably going to reach more for a platelet product like platelet-rich plasma. I think a lot of us too are moving to more of what's called a PRP series, where instead of giving just one, we plan on probably giving 2 or 3 injections spaced out over a period of time.
Yeah.
If I've got like the really older geriatric dog, there's severe OA, there's probably some cartilage, but not a ton. Those dogs, I might be more inclined to reach for a steroid to try to get that under control. But the young dog with a really pristine, happy joint, other than the synovitis, I'm probably going to reach for a platelet product because, you know, our effective benefit is going to be decreased inflammation, but the side effect is going to be negative. There's not going to be a side effect associated with that. Yes. The downside is it's not as effective as we wanted it to be. There are those that will use what's called hyaluronic acid, which is the makeup of joint fluid. Because we know in patients that have a synovitis going on, the synovium is responsible for producing that hyaluron, which is really the nutritional source to the cartilage. So if there's a synovitis, that nutritional source isn't very good. So hyaluronic acid will help re-lubricate the joint, but it also helps stimulate the synovium to produce more hyaluronic acid. Right. And it can act as a bit of an anti-inflammatory. So I think there used to be this aspect of, well, let's use it alone, and it would be given once a week for 3 weeks. So it would be 3 separate injections. Some individuals will combine that with their platelet product. Some people will combine it with a steroid. I think it could be helpful. Based on the human literature, most of these intra-articular injections are going to be the most helpful when there's very mild disease. You know, if we're getting to the point where there's very severe disease, it might be slightly helpful, but it's not going to be near as helpful, and the duration of effect isn't going to be as long. And so again, identifying these patients early is going to give us the best ability with what we have in our arsenal to manage them with.
Yeah, and that still, the truth has to be said, that only buys you a window. If that owner still wants that dog to jump in and out of the car, chase the ball, jump in and out of the ditch, you know, fly up and down the wooden stairs in the family home, it's not going to return you to that. It's give you a chance to change your lifestyle with your dog.
Yeah. And I mean, that's where, you know, the way I look at using things, whether it's injections or pharmaceuticals, is simply to get them out of the state of discomfort they're in and give us the ability to start with the modifications that are going to prevent us from getting back to that point where we were, or at least try to prolong it before we get back to it.
And I think that's modifications. I think that's for surgery or for rehab or for first line vets. We all need to be saying the same thing, which is we're not fixing this. We're buying you an opportunity. The work comes with you, you know, and I really do have a strong passion for the free of charge stuff. I just love it because it's so logical and it's, you know, it's so effective. But trying to get people to understand that is very, very hard, isn't it? They really don't want their lifestyle to change.
Yeah. And you know, I usually am very blunt with people as a surgeon. I say our goal is simply to prolong the life of the joint, because the end point of OA is failure of the joint. And in the dog, that means one of two things: either their quality of life stinks and then you consider euthanasia, or you think about replacing the joint. And so I tell owners, we shouldn't be looking at a 2, 3, 4-year-old dog thinking about joint replacement. If we can do things to prolong the life of the joint and not have to replace the joint until later in life, or minimize the number of joint replacements we need to do. So, you know, in people, it's the same thing. The goal is to try to preserve the life of the joint for as long as possible. The difference is people live 70, 80 years. And so, you know, there's a lot more joint replacements that are done. You know, in the dog, it's how we keep these dogs from needing a joint replacement at middle age and maybe waiting until they're at geriatric, and we don't ever hit that point where their quality of life suffers so bad that now we're having to consider euthanasia, when we've missed years of things that we could have done to slow down and minimize progression to improve quality of life. And
I think just in case there are any, I'm doing a terrible generalization here, you're going to love this. Just in case there's any men listening to this who are kind of like mechanics and they think very mechanically and they're like, no, don't worry, I'm just going to let my dog do what it wants to do and then it's all right, we'll just replace the joints when I need to, a bit like replacing bits of the car. Don't work like that. Don't work like that.
No, the joint they have is the best joint. You know, yes. It doesn't matter how good of a surgeon I am, the artificial joint is not ever going to be as good as the joint they were born with.
Yes, and I must admit, I would be a bit scared. If Luna needed hip replacements, I'm quite cool with that. There's a really high success rate. It's been being done for years. I'm still really quite nervous of other joint replacements. I'm not in your world. I just dabble. I hear bits, but I'm like, oh God, it must be so hard advising. I was talking to Karen Perry, and elbow replacements, they're doing like 5 a year. 5 a year. You know, that's not a huge amount. And
no. And they're tough. They're tricky.
Yeah. So I'm thinking to myself, well, like if that means that they're doing one every 2 months or so, it takes a long time for you to get really like down pat, like the hips. You know, the hips are being done quite often. So guys and girls who've got that kind of laissez-faire attitude of it's all right, we'll just get the hips done, we'll just get them replaced.
No. No. Our goal should be to not do that. And I think the elbows, ankles, knees, they can be done. They're tough. The success rates aren't as high as hips. You know, if they're doing 5 a year at Michigan State, where it's going to be one of the pinnacles of elbow replacements, think of how many dogs you see over the course of a year that have elbow OA. And then they're only doing 5 in a year. So that should tell you right there that we need to do everything possible to do everything that we can to avoid that. Because if it was highly successful, we would just be replacing dogs' elbows all the time, right? No. We need to try to not think that way. We don't want to get to that point. We want to create an environment to avoid that if we can.
Yeah. And we're coming towards the end. Intrigue me, because I know that I love OA. Are you using Shockwave?
Not as much as I think we should. I think we have a Shockwave unit here. I think it can certainly be helpful. You know, when you look at the available literature that we have for some of these modalities, we have evidence of Shockwave for both the hip and the knee providing a beneficial effect. And the nice thing is, it's a long-term effect. So, for example, laser therapy, for example, is short-lived. Sometimes is less than 24 hours type thing. Shockwave therapy, 2 weeks, 3 weeks, 4 weeks, sometimes up to 90 days, you can see a beneficial response. And units have changed such that we can do them unsedated. It's not as painful. So I think it's definitely worth investigating and utilizing. So every now and then when we have the case where they're not responding as much as we would like, or we're having issues, I always say, hey, let's try Shockwave therapy. I think, that can certainly help modulate the inflammatory response, maybe improve some neovascularization, and help regulate pain. That's the other thing, is it can help with pain response.
That's cool.
So yeah, I think Shockwave therapy is something that needs to be investigated more, and I do think it's something that needs to be considered as part of the management when we're starting to think about using modality-based therapies.
Yeah, I'm hoping to get Kiki on. So she. Yeah, so that's going to be cool. Tell us about when you're using laser, because I think laser's become too trendy. A little bit. It's everywhere, and I know from my own experience that I didn't know how to use it until I'm starting to learn more about it, and it has strengths and limitations. What are you using laser for?
I think laser therapy can be beneficial for wound healing, incisional healing. For OA management, if you simply take your dog into the vet, your dog lays down, they do a laser treatment, you get up, you walk out the door, and you say, "We're managing OA." You're not managing OA. I think for it to be beneficial, it's got to be used from a multimodal standpoint, meaning we can utilize it to help with decreasing inflammatory changes, helping promote neovascularization or angiogenesis. So when we're doing other things, whether it's therapeutic exercises, whether it's following up, following underwater treadmill session or some of those things, I think it can be helpful. The effects are short-lived. So, there are all these aspects of, veterinarians having lasers, and the sales rep comes in and sells them a laser and say, you know what? Get rid of your pharmacy, get rid of your scalpel blade. You don't ever have to do anything again except just do laser therapy. So it's being promoted probably a little bit more than what it should be used for. I think of it kind of like supplements. I mean, there's a place for it, but once you hit a point where you're trying to use it when it's past its ability to be effective, then you have to kind of start to realize the limitations. And that's where a lot of people, I think, don't have as much of a knowledge base, or they're paying attention as to what are the limitations on when we should versus shouldn't be using it. Like speaking, it's probably going to be more beneficial very early in the course of disease.
And I think I'm not picking on laser, I'm not picking on anybody. I think it doesn't matter what modality people employ, there has to be reassessment. There has to be an understanding that nothing comes with a promise. Everything, everything needs to be checked. Is it working? Because we know how amazing dogs are. They're bloody lovely. They're bloody lovely. And they will keep trying for us and they will get on with life. And it's our duty of care to make sure they are improving. And it's not just in our minds because we opened our wallet and we quite like the therapist and, you drove the wrong way. So it's got to work. I'm going to surprise you because we haven't planned.
Okay.
I've seen that you've got a little bit of involvement with Synovitin in OA. What's going on there? I read about that age.
Yeah. So Synovitin is a product in the U.S. that it's a radionucleotide, actually from Germany, where they use it in people. And the goal is to deliver a radionucleotide that gets taken up by the macrophages in the joint.
Yeah.
And then it allows those macrophages to self-destruct. It basically is targeted at the synovium and decreasing the synovitis.
Yeah.
And, in a perfect world, we would stop blanketing approaching things, meaning we would stop giving a medication that just blankets a pathway and not really have a specific target. And this aspect targets the underlying issue of OA, which is synovitis.
Yeah.
And one could argue if you can deliver something and eliminate synovitis in the joint, and you've taken away what caused the synovitis to be there, could you, if not slow down, but maybe eliminate progression of disease? So when I first learned of this drug and what they were doing, and their whole goal is targeting synovitis, I was like, this is what I've been preaching for years, is that it's all about managing and modulating the synovitis. And people, that's what they're trying to do. In dogs, we're like, what's synovitis? What do you mean?
Yes. I didn't get taught it. I didn't get taught anything about OA.
It's sort of the forgotten child of OA. I mean, that's what's driving the inflammation. That's what's driving the continued breakdown of the cartilage. And so basically it's an intra-articular injection. The radionucleotide is so minimal that they don't have to stay overnight or anything. You have gloves and a special way to administer it, but then they go home. And the effects that they've used, they did a study with Gulf Coast veterinary specialists in Houston, Texas, and Louisiana State's veterinary school with force plate data, and found that a lot of these dogs were improved up to 9 months, some of them up to 12 months after a single injection. And so it's another tool in the tool belt. Again, I think where it's going to be the most effective is going to to possibly alter the course of disease.
Yes.
Be most effective when it's administered at the very early course of disease. The latter course of disease, it's probably going to help with pain response and minimizing pain, but probably not altering the course of disease. So very, very new. We'll see where this goes. I think it's
keep us posted. I really want to.
Yeah,
Stephen Fox is a very hard man to get to. He's almost
good luck. He is a brilliant individual.
Oh, yeah,
so
yeah.
Being able to talk to him, if you can get him on here, it would be remarkable.
I know. I'm going to keep badgering him. I have a really good annoying trait. I quite often send people video clips of myself going, hello.
Yeah. Can you hear me? Are you listening?
Yeah. But the thing is, even with these new things that are coming to market, it's really exciting. It still needs owners to understand that this disease needs to be caught early. We're not trying to take money off you. We're trying to prevent your dog suffering, pain, and restricted mobility for a big part of its life. And that conversation still hasn't been perfected. That needs a lot more attention. And the only way it's going to be challenged is if all the major dog organizations and veterinary organizations start collaborating that owners need to be aware of it and we need to talk about it. It's a disease that needs to be talked about. I've said it.
Yeah.
Right.
Yeah. Well, and I think financially, it's easy to tell an owner it's cheap to feed your dog less and to exercise your dog.
Yes.
So not trying to take money from you by offering all these things. If we catch it early, walk your dog, keep your dog lean, you might not have to spend a lot more money.
Yeah. And if guys are interested in me kind of like updating you on what I'm doing with the Luna's not got arthritis, like full blown anything going on, but I'm very aware about this problem. Why is it there? Let's get to the bottom of it and let's remedy it. So I can update you guys what I'm up to. Now, we've not had any questions, which worries me. And it happened the other day that people were writing, but it wasn't coming over to Be Live. So let me just have a quick check before we do 10 top tips. Because sometimes it goes live on ear, but not. Yeah, we're definitely live. We're definitely live. Let's see if anybody's writing stuff. No. Dog organisation. It's fine. We just haven't got many questions today, so that's good. Yes. Always great. There you go. We've just been blinding today. That's all. Right, let's do 10 top tips. I'm going to start with number 10 and I'm going to steal the one. Wait. We've talked about it a lot, guys. Don't let us down. It's just common sense. Give them a target, 1% per week, follow up and make it, easy for them, accessible for them. Weighing scales are always free to use, Please wait. Number 9.
Daily exercise. Take them out, get to walking. The absolute best form of daily exercise is simply walking your dog. You don't have to worry about running your dog or trotting your dog. They're very efficient trotters. Simply just get out and walk. When the weather's getting nice, enjoy being outside. You're probably also going to lose some weight yourself by getting and walking your dog. Not that you need to, but
no, we don't know. That could be rude. Number 8, and this is really topical for now. What with all of us being restricted in the homes, there's some ridiculous challenges coming across on social media. And there's one at the moment about getting dogs to jump over a stacked up toilet roll. And we've been seeing this on tiled floors, laminate floors, wooden floors, and these dogs are going flying. It's not funny. It's terrible. Guys, think about it. Would you do it to yourself? No. We saw a clip the other day where someone had put a funny meme to a young Labrador falling down a flight of stairs, and the meme was desperate for a glass of wine. And I was like, no, I don't find that funny. So think about the activities you're doing with your dog and what you're doing in the home, because the home can be quite treacherous. Stafford.
Early identification. If we can identify disease early, we can hopefully slow down and minimize progression. And so for you pet owners, pester your veterinarian, even when your dog is a puppy, to start evaluating and looking. There are tools available that they can now grade and know what the risk factor is, and open up the avenue for lines of communication to minimize progression of OA.
Yeah. Number 6 for me is on the same lines with that. People that are doing puppy parties, it's your responsibility to start talking about this disease, because at that point, the owners are very receptive. They're listening to advice, they're listening for things that could change that dog's life. And if they can be taught how to identify the signs of pain, that arthritis is really common. It's not just a disease of the old. Please, check your dog. Don't do silly activities. Lead example, people doing puppy parties. No slippery floors. Think about it. You have the ability to change that dog's life. Number 5.
Modification. Just because your dog's got OA doesn't mean your dog can't still have fun, but sometimes things have to be taken in moderation. So, rather than sitting on the back porch and throwing the ball for an hour and your dog retrieving, you can do that a couple times. You can even modify some fetch without having to.
Come back. You've gone. You've stalled. No, don't disappear. We're so close. Oh, I'm going to step in. I'm going to do number 4, and I'm going to hopefully David's going to come back and join us and not completely disappear. Number 4 is a phone call that I'm taking quite a lot at the moment. As said, a lot of people are at home and they're spending more time with their dogs, and they're potentially walking their dogs more because more people in the household are wanting to go out for their hour a day. Be careful. These dogs have not got the training to go out that amount. If they're used to doing 20 minutes 3 times a day, ramping it up to 60 minutes 3 times a day, it's going to leave them sore. So please don't do that. I think David's gone. So I'm going to have to do number 3. Number 3, he has gone. He might pop back. Number 3, again, a lot of phone calls because of the COVID crisis, meaning that we're not able to see your pets face to face. So we're doing a lot of triage calls. A lot of people don't realize that the activities that their dog does out of like a behavioral habit, he's coming back. Hopefully he'll be back to join us. A lot of these behavioral things, chasing pheasants around the garden, running down the garden after pigeons. Hello, I'm popping you back. What are you going to be back? I've just done number 3. You've got to do Where did you go? You've got
a quick cup of coffee.
You got 2. I've done 2. Number 2 and number 1.
Let's see. Number 2. What were your last 2? I don't know.
Okay, so my number 3 was that I'm taking lots of phone calls, and when I do my detective work, I find a lot of these dogs have got habits around the home which are exacerbating it. And recently there's been the dog that flies out the back door, chases the pheasants down the garden, up and down the wall, up and down the wall, up and down the wall, and comes back in limping. And they're like, oh, but he likes it. I'm like, no. So look at what your dog's doing and just check it isn't really exacerbating the disease process, and it needs to be modified.
Perfect. Purpose. And this helps with the social distancing that's going on now. So when you're taking your dog for a walk, have a purpose. It's not going to be so that your dog can sniff everything along the way, or so that you can walk with your friends and have a conversation and not pay attention. When you're taking your dog for a walk for daily exercise, have a purpose, pay attention, and make sure we're walking effectively and efficiently.
Amazing.
The last one would be maintaining limberness. There's nothing wrong with stretching your dog daily. I know every day when I exercise, when I get done running or lifting, I stretch. But I don't do a whole bunch of stretching beforehand, because we don't want to do a lot of just jerking on tissues before they're warmed up. But following activity, stretching them out will help maintain range of motion. Because remember, maintenance of range of motion means maintenance of function. Loss of range of motion, loss of function.
Yeah, and that's brilliant. And you can incorporate that into your walk. So I know what I'm like. I'm a busy brain and I forget to do things because I'm already moving on to the next thing. But what I'm trying to do in my life with Luna is that we start off with a lead walk to warm up, and then we do whatever we're going to do. Then we incorporate some exercises into it. And then at the end, we do things like hiding treats up tree trunks. So she has to stretch up for the tree, and she has to get up on a bench and come down. And it's just cooling the tissues back down again. You can do it in your walk. It doesn't have to be an extra 20 minutes that you need to find today. So I think outside the box a bit. David, you're amazing, as always. Love it.
Well, thank you for having me back.
No, it's just great because it's so nice to meet people that are just so passionate about it as well. And human. There's no arrogance, no academic falala with you. You're just human about it, which is awesome. So thank you.
Yes, I hope to be able to be back. Take care.
Yes.
Stay safe.
Yes, please come back. Thanks, Cap. Till next time.
All right, bye.